Hi guys, I'm just going to do a quick update video today, just really to talk a little bit about radiotherapy, which is what I'm actually having at the moment. For anyone who's not had radiotherapy before, it can be a little bit daunting because you don't really know what to expect. But I have to say, in my experience, out of all of the treatments I've had so far, so radiotherapy, surgery, and chemotherapy, the actual process of having radiotherapy is definitely by far the easiest in terms of actually receiving the treatment. It's very, very quick actually, and it's actually quite painless, well, completely painless, having the procedure. So basically it's normally done on a daily basis, Monday to Friday. You'll have a scheduled scan before you actually start your radiotherapy, which is done in a slightly different department, but again, it doesn't take very long. You'll basically go to your appointment time. They'll ask you to drink 2 cups of water, and then you need to actually hold that in for I think in total they'd like you to hold it for about an hour, which I know for some people is probably going to be quite hard, but if you can't do that and you do actually have to go to the toilet, then you just tell them and then you just drink a bit more and wait a little bit longer. Basically you need to make sure that you have a full bladder. It's to help to try and release some of the radiation, I believe. Once you've had your treatment, you empty your bladder afterwards, and it just helps to kind of flush that out. But you also need to really need to drink a lot of water all the time during radiotherapy, because you do really need to try and flush that out. The more you drink, the lesser the side effects will be. So drinking a lot of water will really help. So yeah, so you drink the 2 cups of water and you wait a little while, and then you go in and it's almost like a CT scanner really. It looks very similar to that. And this is basically where they're doing measurements. So they'll have scans that you've had done previously. And then there'll be different measurements that they take from different angles and different heights, etc. And they'll mark you with tiny, tiny little tattoos. They're literally like a pinprick. Tiny little dot. Now I don't know, it's probably different depending on where you're going to have it. Now when I first had radiotherapy in 2016, I actually had it for a lymph node, which was kind of behind the stomach area somewhere, quite high up in the back. So they did 3 of those tiny little tattoos that went down the abdomen. So one sort of just below the breastbone or around there, one sort of relatively near to the belly button, and then lower down sort of at the start of the groin area. And then one either side on each hip. So they literally just do that whilst you're in that that pre-planning scan. The nurse will just do it for you there and then. It really doesn't hurt, as I say, it's the tiniest little mark. And then once they've done that, that basically allows them to plan what your scheduled treatment's going to be. So what you'll basically end up with is a schedule of appointments. So Monday to Friday throughout your whole treatment, however long that's going to be. They will give you set times, so you'll know exactly when and where you're having your treatment every day. So once you actually go in for your first session, normally they'll ask you to arrive an hour early, just so they have time to sort of prepare you and talk to you about what exactly is going to happen and talk you through it, just so that you're really clear before you start. And also to make sure that you do drink, again, those 2 cups of water in the hour prior to your treatment starting. Now and then they basically give me the option to come an hour early every day and drink while I'm there at the hospital, or just make sure that I drink on the way to the hospital. I choose to drink on the way to the hospital because it's basically an hour's drive to go there. So I just have my water bottle with me and make sure that I drink that water before I arrive at the hospital, and that works fine for me. I think maybe if you're going to struggle to drink water, then maybe it would be a good idea to maybe go earlier and actually do it at the hospital, so that sometimes it can just prompt you to drink more, because obviously the nurses will prompt you to drink before you go in. But that's optional, as I say, whichever way you want to do that. So once you've had that time, you'll basically be called through. You'll get changed. Again, it depends where you're having the radiotherapy. Now, last time in 2016, obviously it was the upper half of my body. So the entire upper half, I had to just have a hospital gown with nothing underneath. This time I'm having it to the pelvis, so it's the opposite way around. So I can keep all of my top half on, so my bra, even though it's underwired, all my clothes on top basically, but nothing obviously on the lower half. I do keep my socks on because I'm on these blood thinners still, and they do make my hands and feet get cold very quickly, and I really struggle to get warm afterwards. But one thing you need to make sure of is a good idea to get some of the socks, like slipper socks that have the sticky bits or the little rubber bits on the underside, because you do obviously need to be really careful when you're walking through, that you don't slip or fall. It can be quite slippery, and it can, with side effects, you can get sort of drowsy and dizzy, so you do need to be really careful there. So maybe get a few pairs of those slipper socks would probably help. So you get changed and they call you through, and basically you just get onto the bed, which again doesn't look dissimilar to a CT scanner, and the main difference being that normally in a main scanner it's one large sort of piece that goes right over you in a circle, and the bed goes through the middle. With the radiotherapy, you do still lie in a bed which is in the middle, but it has different arms that seem to come off at different angles. So you've got the main bit which actually sends out the radiotherapy, but then you've got other arms which I think they use to do scanning as well, all part of the same machine. So you will just lie flat. They'll get you into the correct position, and line up with the tattoos that you've had. They'll use sort of just lights basically with and different measurements and rulers to get you in position. You shouldn't really have to move too much yourself. They might ask you to shift in one direction or the other when you first get on the bed. But then a lot of the time what they'll do is they'll say, I'm just going to move you, but don't help me. So basically it was quite difficult at first, because your natural instinct when someone goes to sort of move your hips is to naturally just help them by moving yourself as well. But you really need to just basically, when they ask you to do that, just lie as a dead weight. It will feel like they haven't moved you at all, but obviously they have, because they're trying to line you up exactly as good as they can with the measurements that they've taken from the planning scan. So that really, again, doesn't take very long at all. It'll only take really a couple of minutes to get you in the correct position. And then they'll actually go out and leave you in the room on your own, and the treatment will start. From what I've experienced, what they'll normally do is the first few days that you go, they'll scan each day. And I believe those scans are really for accuracy, to ensure that obviously that the treatment is targeting exactly where they want it to. These scans won't be as detailed as an MRI or a CT scan or a PET scan. So they're just used to basically make any minor adjustments to measurements as you're going through the treatment, I believe. Now that scanning, again, it will scan, it will move a paddle, and will come out, and it will move quite slowly, but right around your body. That probably only takes maybe 2 to 3 minutes to do that whole scan where it rotates around you. And then after that, obviously again it depends where you're having radiotherapy, but for me at the moment on the pelvis, it starts from behind me, so underneath the bed that I'm laying on. Then it moves to the left side, then to the top, and then to the right side. Now each time it stops, you don't see anything, you don't feel anything at all. What you will hear is a noise of when it's actually giving you the treatment. I'm not going to try and do the noise because it's really hard to do, but it's sort of like a whirring noise. Again, each time it stops at a different location, it probably only takes, I would say, a minute at each position. So probably about four to 5 minutes in total, because obviously it has to slowly move around to get to those positions. And then that is it. They'll lower the bed and then you're free to go, get changed and go home. So as I say, the treatment itself is very quick. It's not painful at all. Now, side effects wise, what I tend to find is that it really can vary. Now, this is only the second time I've had radiotherapy, but in 2016 when I had it, it was really to try and completely get rid of the small amount of cancer that was visible in that lymph node sort of behind the stomach area. So I actually had a full 6 weeks of treatment. They call it fractions. That's basically just each daily session, so they'll tell you how many fractions you're having. So yeah, in 2016 I had a lot more. This time I'm only having 10 fractions altogether. Basically the difference being this time they're really just trying to reduce the size to take some pressure off the bowels and the whole really abdominal area where the tumour is actually squashing and causing me quite a lot of problems and quite a lot of pain. It's really just to try and relieve some of those symptoms before I go into the main part of my treatment, which, as I said, is hopefully going to be immunotherapy. So this time round, the main side effect I've really had so far, now I've done, it's now Sunday, I did this whole week, so I did Monday to Friday. I also did 3 sessions the week before, 2 sessions, so I've done 7 sessions altogether. And the only real side effect I'm having at the moment specifically from that is the tiredness. I do find that having radiotherapy really does seem to just really wipe you out, really make you extremely tired. But I also have to say as well, there's a big difference this time. Last time when I had it, because it was going right around the stomach area, I didn't even make it home after my first session in 2016 before I was sick. I had terrible sickness when I had it before, and I think mainly that was because of, as I say, where it was going directly over the stomach, because normally with radiotherapy, the side effects that you will get, apart from tiredness, which I find starts pretty much straight away, most other side effects actually tend to come later on. And the way that they described it to me with radiotherapy is it's quite different in the way that it works. Although you're having treatment every day, it's a bit, they said to me, it's basically, think of it like a microwave where obviously you put your food in the microwave and it does heat up immediately, but it will keep cooking after you take it out the microwave. And that's basically kind of the analogy that they use. So radiotherapy will obviously will start to build up in your system immediately, but the effects of it, they normally wait a few weeks after you've finished your treatment to actually check whether it's worked or not, because it takes quite a while for the radiotherapy to work through, and it, as I say, does continue to work even after you've finished having the treatments daily. So the side effects quite often will come later on, and actually you might feel quite a lot worse when you've actually finished the treatment for a couple of weeks and then start to feel better. So it'll be interesting to see this time around what kind of side effects I will have and when they'll come about, because I say obviously it's a bit too early to tell at the moment. And because I'm only having 10 sessions as well, I'm not sure if I will get any harsh side effects or not, we'll have to wait and see. Obviously, having it in the pelvis, the main issue is there is a risk of long-term side effects for the bowels, i.e. so it could be something that damages the bowel that's not going to recover. That is a big possibility. And also, obviously, the obvious one is the fertility again. It's right all over where my ovary is, where I'm having treatment. So there is a big chance that that will put me into menopause. Obviously, nothing's certain. But yeah, I've kind of have to accept that that's going to be a huge possibility this time round, because obviously that's the area they're doing it in. So yeah, it's really a case with radiotherapy is really don't be, it is scary, I know, when you're doing a new treatment, but it's nothing to be scared of, definitely not having the treatment. As I say, you will hear the noise of the treatment happening, but I promise you, you won't feel any pain from the treatment actually being administered, and you won't be able to see anything. As I say, it's more sort of a slower, gradual build-up, and the side effects tend to come later. I guess the only real side effect as well, which I believe is very common, is having sort of a redness to the skin in the area that you're having the treatment. I didn't actually get that at all in 2016. I'm not sure if I will get that this time around. Again, obviously I'll keep you updated and see how it goes. But yeah, I mean, the painkillers are still working. So I've had still under huge relief. I have to say, like, so thankful. I mean, all for so many times during the day that I just often think how thankful I am that I'm not in that pain. I'm hoping that will last. They can have a change to the dosage still, so I do have quite a lot of flexibility still in the dosage that I'm taking. So that should hopefully continue to be managing my pain effectively for quite some time, hopefully. But at the moment, as I say, the main thing is just the tiredness. I would probably advise that if you are having it, if you are having radiotherapy, really do try to get as much help as you can. I know that's not going to be easy for a lot of people, but don't be afraid to ask for help, because the tiredness, as you can probably tell, my eyes are closing now. The tiredness is really difficult, and if you've got kids to look after, or even if you're only looking after yourself, to be honest, at times it can get very difficult. Yesterday, on Saturday, I basically spent the whole day in bed. I got up to have a bath, and I got up to I had to really force myself to wake up to drink water, because it's so important to keep drinking water. But yeah, it will get to a stage where you will just feel completely wiped out. So if at all possible, really try to ask for some help, even if it's just with general housework and things. If you've got a neighbour or a friend, anyone that can just help you here and there, will probably make a big difference as well, if you're able to do that. So in myself, in general, I'm actually feeling okay as well. As I say, in terms of the last video that I did, the week that I'd had was absolutely miserable. But actually, although I am feeling quite tired, or very tired, I'm feeling so much better in myself. So much better. And generally, the last sort of week, I've managed to really take my mind off things quite a lot. So I haven't been in that state of panic about whether I'm going to get the immunotherapy or not. I think probably these painkillers that I'm on, because they're very strong, are not only helping me sleep, but they're also really relaxing me, which also makes a huge difference, because I was just really so sort of desperate before. My anxiety, I get quite bad anxiety anyway, but it was just absolutely through the roof. Terrible, just didn't know what to do with myself, physically and mentally. So yeah, it has really, really helped to relax me as well, which emotionally has really helped to keep me more stable. So yeah, so I'm doing okay. I have 3 sessions of radiotherapy left, so Monday, Tuesday and Wednesday. And then it'll be a case of really following up to try and see what's going to happen with this immunotherapy treatment. But as I say, it is quite normal after radiotherapy for them to wait a few weeks and then do a scan to actually see what the effect of radiotherapy has been, because you can't really tell the full effect until a little while afterwards. So it's not going to be a case of me finishing radiotherapy and going straight into immunotherapy anyway, even if it does get approved. There will be a gap. But even so, I will obviously keep you updated in terms of how I'm feeling and what kind of side effects I get from the radiotherapy, if any, and sort of at what point they start and how that progresses. So I will speak to you soon. Take care, guys. Bye.